Resuming debate, reprise de débat. The honourable member for Vancouver Kingsway.
Thank you, Madam Speaker. I rise with pleasure to address this important bill before the House, Bill C-223, an act to establish the Canadian Organ Donor Registry and to coordinate and promote organ donation throughout Canada. Madam Speaker, this bill proposes to establish a Canadian Organ Donor Registry to centrally compile information on organ donors and potential transplantation recipients across the provinces and territories. The purpose of the registry would be to increase efficiencies associated with patient assessment and organ allocation to improve patient wait times, hopefully to reduce them, for transplantation and reduce the number of lost transplant opportunities. For years, Madam Speaker, New Democrats have supported better national collaboration in organ and tissue donation and transplantation. Specifically, the New Democrats have supported the creation of a national registry to achieve this objective. So we are glad to support this initiative by my honourable colleague here today. Some key figures. Madam Speaker, every year 1,600 Canadians will be added to organ waiting donor lists. Over 80% of Canadians say they would donate their organs. However, fewer than 20% have made arrangements to donate. At any given time, approximately 5,000 Canadians are waiting for an organ or tissue transplant. Now, Canada's deceased donation rate is relatively low compared to other comparable countries. According to 2009 data from the International Registry of Organ Donation and Transplantation, Canada placed below countries such as Spain, Uruguay, USA, Cuba, and the UK in donation rates. Canada's donation rate is less than half that of leading countries, and 1/3 of Canadians who need a transplant will never receive one, according to Canadian Blood Services. Madam Speaker, we can and must do better. New Democrats have been working hard in recent years to establish a national organ donor registry to save and improve the lives of Canadians in desperate need of transplants. We believe Canada can do a better job managing the organ transplant system, and the establishment of a national registry is a critical first step. Madam Speaker, this is the latest in a series of similar private members' bills on a national organ donor registry that have been introduced over the past 15 years. The last two variations were introduced by New Democrat Member of Parliament Malcolm Allen in the 40th and 41st Parliaments. A bill proposing a national organ donor registry has never been voted on at second reading. Now, I'm very pleased to note that the son of the sponsor of this bill, the Member of Parliament for Edmonton Manning, has a son who was born with a rare liver disease and has required 3 life-saving transplantations over the course of his lifetime, I'm advised. Now, this is a combination of personal experience fused with public policy that I'd like to congratulate that member on. Madam Speaker, in 2011, Canada's organ and tissue donation transplant communities, in collaboration with Canadian Blood Services, produced a document entitled Call to Action, which formally recommended the establishment of an integrated interprovincial organ donation and transplantation system. The Call to Action recommended the establishment of this interprovincial system by 2017. Now, the authors of that document believe that a nationwide coordination would allow Canada to better reach our potential in organ and tissue transplant donation. They called for the creation of a system that would be consistent across the country, easily accessible, available online, and used to legally authorize donations based on the wishes of the donor. So a national registry will not only improve the availability of organs to patients in need, but could also reduce provincial healthcare costs on those on waiting lists as they are treated more quickly. It would also address the disparities in wait times across regions and provinces by increasing the efficiency in the supply of donor organs and tissues. Madam Speaker, New Democrats support bringing this bill to committee to permit an in-depth study of the provisions of the bill and perhaps see if there's any improvements that can be made. Due to the important life-saving potential of this bill, it is vitally important that Parliament get the details right. For example, we believe that the special status of Quebec must be addressed within this bill. C223 lacks some of the implementation details included in Mr. Allen's former National Registry bill, including a recognition of the right of Quebec to operate a parallel registry as they do today with blood and tissue collection. Additionally, this bill gives substantial power and responsibility to the Health Minister rather than delegating responsibility to the administration of the registry to a registrar, as did the former bill. This should be studied as well to determine the best approach. Finally, in Bill C-223, both the reporting mechanisms to Parliament and the process for provincial affiliation to the National Registry are not detailed when compared to the former bill. These details require closer study. I believe, Madam Speaker, that Parliament should also study the experience of other jurisdictions who have implemented presumptive organ and tissue donation. That is, a system where people are deemed to agree to be a donor unless they explicitly opt out, as a means of dramatically increasing potential donations to save lives. This is not in the bill currently, but I think it's an idea that is well worth exploring to make sure that every single Canadian, man, woman, and child, has access to necessary organs and tissues if they need it to save their lives. Madam Speaker, in 2014, the NDP supported also removing the ban on certain organ and tissue donations made by men who have sex with men. Efforts to create a national registry should go hand in hand with efforts to remove this unscientific discrimination and replace it with a science-based behavioral screening process. Madam Speaker, I think it's particularly appropriate to reflect today on this item and to express my shock and revulsion at the hate crime committed this weekend in Orlando, Florida, where approximately 50 people were targeted and murdered for their sexual orientation. And I think I speak for everybody in this House to express our solidarity, our prayers, our comfort, and our expression to stand with the LGBTQ community, not only in Orlando, but in North America and across this world, to say that this kind of hate crime has to be denounced, and denounced firmly and by everyone. So, Madam Speaker, this bill is timely in a number of ways, but particularly in terms of urging the government to take immediate measures to end the current discriminatory policy governing blood and organ donations in the gay men community, I think would be a good first step to start building the kind of science-based policy, the kind of understanding, the kind of smart policy that makes everybody feel included in this country. Madam Speaker, New Democrats will continue to work positively and across party lines with our Conservative colleagues and Liberal colleagues to build a better healthcare system for everybody in this country. I note that I believe that the Liberal government will not be supporting this bill. I would urge them to reconsider that position. Second reading is an opportunity for every member in this House to express our agreement or not with the spirit of a bill. Notwithstanding that we may have some concerns about particular details, we should be able to discuss those details at committee, and so I would urge all members of this House to stand together and support this important bill, to support it in spirit and in principle, because any concept or policy that helps organ and tissue donation become more available to Canadian men and women in this country, and children, of course, is something that we should be giving every opportunity to debate and put into law. Madam Speaker, how much time do I have? Thank you, Madam Speaker. Now, on that, I would be remiss if I didn't point out that there have been some missed opportunities in this regard. The former government did have a full 4-year term to take action on establishing a national registry, particularly after the release, thank you, Madam Speaker, of the April 2011 Call to Action report and the subsequent election of the previous Conservative government just a month later in May 2011. So it is unfortunate that 4 years have been allowed to pass. But as my father used to say, wisdom comes so seldomly that it ought not to be rejected simply because it comes late. So I'm happy to see that a member of the Conservative caucus, the member for Edmonton Manning, has put forward this bill. So I urge all members of this House to give this bill the study it requires, to support it at second reading, and let's see if we can't make the improvements that we need to make a committee to get everybody's vote in favour of this bill and implement this as soon as we can for the health of all Canadians. Thank you, Madam Speaker.